Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
All right, so we're back here at the office of Be Kind Pediatrics. We're continuing our mini-series on children with autism. On our previous episode, we kind of covered the topics of what is autism, when can it be diagnosed, what's the role for potential genetic testing in autism, and what is the treatment for the core symptoms of autism. Today we're going to explore treatments for some of the comorbid symptoms of autism. We're going to talk about therapies I think you definitely should not try, and then we're going to talk about therapies that are kind of in the pipeline or being in current clinical trials that are showing promise.
What other types of therapies are out there for different symptoms of autism?
So I think the most common comorbid symptoms of autism that there are FDA-approved treatments for are going to be that of irritability and insomnia. So let's talk about irritability first. FDA-approved medication for irritability in children with autism are going to be risperidone and Abilify. Risperidone has been studied for longer, but potentially has the side effects of weight gain and sedation, which Abilify also has, but maybe to a lesser extent. So I think if you're a parent, you're concerned about irritability in your child, you definitely should bring that up to your pediatrician. They'll probably do some screening and ask you some questions and try to get at how bad is that irritability. And then they may potentially talk to you about risperidone or Abilify. Children with autism who are already overweight or struggling with weight or appetite control, risperidone might not be the better choice compared to Abilify. So they might, in that case, go with Abilify even though risperidone has been studied longer.
So Dr. Rolnick, I have a friend. She has a child, 6 years old, who has autism and insomnia, wakes up in the middle of the night religiously every night, 2-3 o'clock in the morning, hard to go back to sleep. What do you recommend?
When you, as a parent, have a child with autism, or for practitioners who treat children with autism, is to ask, because many parents are so preoccupied with the other symptoms of autism and addressing potentially the other medical problems with their child, they forget about sleep, or they don't think it's a big enough problem to bring up. But this is very common, actually, what your friend is experiencing. Almost 80% of children with autism will have some form of sleep disturbance and or insomnia. If this patient walked into my office, my first thoughts would really be, A, when the child wakes up, are they able to go back to sleep? Are they co-sleeping? How long is it taking them to fall asleep? And I would really start asking a lot of particular questions about the sleep hygiene or sleep environment. So the first place I start is trying to really optimize the sleep environment. So that's going to be things like having a really solid bedtime routine. There's really good evidence and research out there that shows consistent bedtime routines in all children, regardless of whether they have autism or not, results in improved sleep latency. So that means the time it takes a child to fall asleep, how long they sleep for, and a reduction in nighttime awakenings. So I always start with bedtime routine. And in children with autism, I think storyboards or visual calendars can really help communicate those expectations and set that routine up to prime that child's brain that it's time to go night-night. Mm-hmm. After routine, I kind of focus on what's the sleep environment. So you want a really potentially dark room, except some children with autism do need a nightlight for comforting, and that's okay. But if they don't, I want it so dark that it's hard to see your hand in front of your face. Mm-hmm. It should be actually relatively cold. The room should be a little bit colder than you would normally expect, so somewhere between 68 and 70 degrees Fahrenheit. White noise can go both ways. So I always say to try it, and if you're going to try white noise, you want a unifrequency sound. So that would be something like a fan, as opposed to a di-frequency sound, which would be something like ocean sounds, which is a common mistake I see. Sounds with multiple frequencies can actually stimulate a child's brain and cause them to wake up. So unifrequency sound like a fan or just simple white noise, nice and cold, nice and dark, bedtime routine. You want them in really comfy clothes. Children with autism can be particularly sensory sensitive. So clothes and blankets should be nice and even, often kind of organized and comfy. So bedtime should be consistently somewhere between 7 and 8 p.m. for most children. And the last thing, I can't believe I forgot this, is screen time. So screens are often used in children with autism as a tool to help them self-regulate and calm. But children with autism have been shown to, or theorized, and there's potentially been shown to have not make melatonin, which is that sleepy hormone your brain makes to tell your brain to go to sleep. They potentially don't make it in the same way that other children make it. And melatonin actually will be produced in lesser quantities in the presence of blue light. So you want to really eliminate that screen time 2 hours before bedtime, and consistent bedtime at the right time. Some children with autism who are being put to bed very late, like 9 or 10 o'clock at night, are actually overtired, and it's harder for their brains to calm down and fall asleep. Once you've kind of optimized that sleep environment for a few weeks, the next thing I ask about, in this case, how long is it taking the child to fall asleep? Some children, again, with autism might not be making melatonin in the same way as other children. And so this is one area where melatonin has been studied in sleep latency in children with neurodevelopmental disorders. So that might be a therapeutic consideration. The one thing with melatonin is it's not FDA regulated, and so the amount of melatonin from pill to pill and from brand to brand can potentially be different. So my advice here is really, if you find one that works for your child, stick with that brand and that particular dose. Again, as with all therapies, just because you start something doesn't mean you have to continue it. So maybe potentially if you get a child who's really sleeping well consistently on a regular basis and the parents really want to wean them off melatonin, that's also a consideration and an option. And the last medication and area I want to talk about is frequent nighttime awakenings, because that's also a frequent problem. And a lot of times I see when these children are waking up multiple times a night, they're going into mom or dad's room and co-sleeping. And so this is, again, where I kind of would urge parents to advocate for themselves and their children, let their pediatricians know if this is going on, but also for pediatricians to ask very specifically, how long are they sleeping? When are they going to bed? What is the sleep environment? Because you might say, how long is your child sleeping? They say 8 hours a night, but those 8 hours all might be in their parents' bed. And we know that the quality of sleep a child gets when they're co-sleeping is not the same quality of sleep as if they get on their own. And as with all children, sleep is so important for your brain, for development, for learning, and for learning the ability that we're asking children with autism to learn those, 30 to 40 hours of behavioral intervention and learning how to self-regulate if they have any irritability or emotional concerns. Really requires a well-rested brain. If you were not getting consistent good sleep, you would be irritable too. And so for children with frequent nighttime awakenings, clonidine has been well studied. That's an alpha-2 agonist, and it is dosed right before bedtime, and that can be an option to talk about with your pediatrician, or they might potentially bring up with you if they're noticing your child has multiple nighttime awakenings. And it can be used in conjunction with melatonin if your child's having both really prolonged sleep latency and multiple nighttime awakenings. And just like we were talking about before, sometimes you get a child who's sleeping really well, you reset their circadian rhythm, they're doing great, and you might talk about starting to wean some of those medications off once they're sleeping well. But I found that in children with autism who are not sleeping well, and then who begin to sleep well with these kind of interventions, the difference in their behavior and the quality of life for both the child and the parent is really improved. And so this is one place where I think, definitely ask about it, talk to your pediatrician about it, pediatricians talk to your patients about it, and let's just make sure that we are helping those children with autism who also have sleep difficulty.
Dr. Rolnick, can you talk about the therapies that could be harmful or dangerous to patients with autism?
Yeah, so I think when approaching kind of any therapy, specifically children with autism, you have to really think about, because there's so many and there's lots of areas of ongoing research, you have to think about what are the risks, what are the benefits, and if there's a middle ground, can you meet parents kind of halfway in the middle ground areas? There are some therapies out there where I right off the bat will say, this is harmful, please don't try this, I really strongly recommend you do not do it. And the first one that kind of comes to my mind when I'm thinking about what's potentially offered or available to parents is something called chelation therapy. So chelation therapy is used in medicine to treat things like lead poisoning and other toxic heavy metal poisonings, where we actually give a child a medicine and help get rid of that potential poison. So it is marketed to families as a way to pull out heavy metals and toxins in their children's blood that is causing their autism. But there have been children who have actually died from chelation therapy in this regard, who are using it for not a medically indicated cause. And even with children with true heavy metal poisoning, we use it very sparingly and only when we really truly feel the benefits outweigh the risk. Another area where I really strongly recommend it, but it is available, is hyperbaric oxygen. Hyperbaric oxygen may not truly be like life-threateningly dangerous or harmful, although it could be, but it's definitely very costly. And I think that is a harm to families, because that money, it could be used for other things, potentially for that family. We're talking about things like food, clothing, paying their mortgage. Parents with children with autism will spend any amount of money to try to get their child better. And this is a very costly out-of-pocket therapy for this indication, and I think that's a real harm. Another area that I would say definitely I think is harmful are things like steroids or immunoglobulins, which are marketed as potentially improving a child's immune system, because there is believed to be a role between the immune system and autism. But these are also very harmful and don't have any benefit in this area. Even when we use them in medicine, we're always balancing again that risk versus harm ratio. And immunoglobulins in particular are actually a blood product. So they can cause things like anaphylaxis, which is that severe allergy where you stop breathing, your throat closes up. They can transmit disease potentially like any other blood-borne product. So I strongly recommend against that. The last area I'll kind of touch briefly upon is the ketogenic diet, which has gotten some press recently, but hasn't been shown to and has no evidence to support its use in autism. And the problem with the ketogenic diet in children is, like the name says, it causes ketosis, which actually means that your blood is becoming acidic, which is very unhealthy and not beneficial for children.
Dr. Rolnick, you spoke about the keto diet. Are there any other diets that you would recommend?
So I will say that there is little to no evidence that specific diets are helpful in autism. However, if a family comes to me and they want to go eliminate preservatives and simple sugars from their child's diet, I think that is great. I have, in my experience, found it to actually be helpful for some of the behavioral comorbid symptoms of autism, like irritability and behavioral regulation. I mean, in general, having a balanced, healthy diet is better for your overall well-being, and I believe your brain health as well. There has been some interest in looking at gluten-free, casein-free diets. And so there was a meta-analysis that looked at gluten-free diets in autism and didn't find any evidence to support it, but on secondary analysis found potentially some improvement in those symptoms of irritability and behavioral dysregulation. And so I think if a parent or family is interested in gluten-free, casein-free, or limiting preservatives or simple sugars, I would definitely have that conversation with them. And I think there is potentially a benefit in that kind of behavioral dysregulation. There are potential harms I discuss with them, and that's going to be mostly cost, and also the fact that restrictive diets can potentially be isolating for some children. So I think you have to balance those things. But that's kind of that middle ground of therapies where I say, this is kind of the information on it. We have a conversation and decide what the parents feel like is really in the best interest of their child.
I have read on the internet, on the news, social media, that parents are giving their children CBD. What are your thoughts on that?
So I think the theory behind CBD is that it might potentially cause some calming effects. I usually tell parents, and what I tell everybody is there's no evidence to suggest that CBD is helpful in patients with autism. This is, again, that risk versus benefit conversation. I definitely strongly do not recommend that parents give their children CBD oil if it contains THC, which is that part of the CBD that can make you have like hallucinations. And I also strongly recommend against it, if their child has any sort of seizure disorder or is on any other medications. And if a parent is going to give their child CBD oil, I strongly do recommend that they have a conversation or let their physician know, because CBD oil does have interactions with other medications, specifically seizure medications, where it can make that medication more toxic. They should definitely just let their doctor know so that they can be aware of those interactions and potentially monitor them for the child.
Dr. Rolnick, are there any cutting edge therapies?
So there are always areas of research in autism that are ongoing. I think this is an area and a field of medicine that is rapidly being explored. A few that I think are interesting personally are one, oxytocin and dopamine, or a derivative of dopamine called L-DOPA. So these are currently being studied by a branch funded by the NIH, looking at if oxytocin and dopamine, which are kind of those happy hormones, can be used to improve social motivation in children with autism. So they're looking at giving a dose right before something like ABA or behavioral intervention, specifically behavioral interventions for social skills, if this increases the motivation in children with autism to learn those skills faster. Another area that I think is promising and interesting is targeted gene therapy. We kind of have been talking about genes and genetics a lot. There are areas of medicine like, for example, SMA currently has a targeted gene therapy, which is spinal muscular atrophy. And they are currently looking for gene therapies, things like Fragile X and Rett syndrome. They already exist there, but there are currently clinical trials ongoing for Angelman syndrome. And all three of these syndromes are associated with autism. So I think in the future, I'm hopeful that for subsets of genetic diseases that are linked with autism, we're going to start seeing some targeted gene therapies. So again, I thank everybody for listening. We hope this episode was interesting and helpful and continues to be a great resource for families out there. Next week, we are going to focus on questions that we have received from the community. So again, if you have any questions or topics you would like us to cover, please post them below.
Thank you for watching The Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.